So microdermabrasion is a treatment we offer to our patients prior to any sort of skin conditioning routine. It involves sort of using a sandblasting type technology, if you like, where a patient comes in and a microdermabrasion machine is applied to their face. It takes off that dead top layer of the skin and just freshens the face up. We don't promise that it's going to change lines and wrinkles. It won't get rid of pigments that have been there from a result of sun damage, but it will give them a fresher approach and allows us a new fresh palette to start on in terms of moving on to other treatments following. So it's a good starting point for any aesthetic routine. It's suitable certainly for younger patients who might want to have a fresher look before a formal or a big event, and also as their starting point in an aesthetic treatment plan for our older patients as a way of sort of starting the cleansing of the palate of the skin. It takes about half an hour and minimal downtime and no pain involved with it. Chemical peels are a good baseline to start with, a bit like microdermabrasion. Often we find that a microdermabrasion treatment first to sandblast the skin, like we're saying, then a series of chemical peels can freshen up the face and get rid of all that sort of DNA damaged skin that we know is there, as well as improve very superficial fine lines and wrinkles. Addresses some pigment concerns, so if people have got melasma or hyperpigmentation issues on their face, if they've got sebaceous skin conditions, acne scarring, active acne it can be used for. So there's a variety of different chemical peels that we offer in our clinic. Our nurse will usually perform the peel on the patient. Some peels are very much a lunchtime peel and the patient will walk out of here just looking fresher without looking too battle scarred. Some of the deeper peels are offered in situations where you've got a lot more sun damage or a more mature face that is probably looking for a more rejuvenated look as well. But they are very effective and probably underutilised in many aesthetic clinics because they are so simple to perform and quite affordable for patients. So low-level LED light therapy has been used extensively in the past 10 years probably. First discovered in relation to photodynamic therapy, but as time went on we've discovered it's been very useful for other dermatological conditions. We use our light therapy back to back here. It's going all the time, and the majority of the patients who get maximum benefits are the acne patients. So a combination of blue and red low-level light therapy twice a week, done for a period of about 4 to 6 weeks, is a good adjunctive treatment in relation to acne. Also in combination with antibiotics and the other topical retinoids that we'd use for an acne patient. And most of our moderate acne patients actually improve in that 6-week period and get to the point where they can come off their oral antibiotics a lot earlier than they would be if they were being treated with that alone. And fortunately, not many of our patients end up with Roaccutane as a result of that if we get onto them with the phototherapy early enough. It has also been used for psoriasis, for eczema. We use a lot of it for our post-operative wound healing, and the yellow light therapy, which is slightly deeper therapy, is used in that indication. And we're seeing excellent results. So it's wonderful to think you've got an aesthetic treatment that doesn't involve drugs, that is completely harmless to the patient. It's low cost and treats all these other dermatological conditions as well. Photodynamic therapy has been utilised a lot in skin cancer medicine. Fantastic way of preventing future solar keratosis from occurring, from mopping up all that actinic damage and pigmentation that we get on our faces as a result of the sun damage over a period of time. It involves having a special cream added onto the face which needs to incubate for a period of about 3 hours. Patients need to stay upstairs, confined to a dark room, somewhere where they're not going to get activated by light. Following that period of 3-hour incubation, we then put them under a red light which activates the agent which will then treat the sun damage on the skin. And in some cases, some very superficial skin cancers can be treated as well. We have an assistant in the room with them constantly fanning their face, spraying them, alleviating those fears that they may have as the cream activates. 12 minutes of light activation is usually enough to produce the desired effect, and the studies have shown that it's best if you're treating an area of solar damage, or if you want to get the maximal benefits from the procedure, that it's repeated after a period of a month or so. So it's an ideal treatment for patients who we see repeatedly at the skin cancer clinic having topical treatment after topical treatment and still not quite getting a good result. So in a patient who has multiple solar keratosis on their scalp or previous excisions of superficial non-melanoma skin cancers on their face in the past, the ideal. So microneedling is something we encourage our patients to do at home in the form of using a derma roller in combination with topical antioxidants, but it's also a treatment we can offer for at a deeper level in the surgery. So we use a microneedling device which is applied to the face after a topical numbing cream. Ideal for acne scarring. We use it in conjunction with platelet-rich plasma therapy to instill the plasma through the skin. It can be used in areas where scarring, so train track scarring that patients have had as a result of previous procedures and surgical operations. Ideal for stretch marks. There's a whole range of things that microneedling can help, and it's a very sort of affordable treatment with minimal downtime and minimal pain as well. So it's a popular form of treatment and something that can produce very long-lasting and natural results. We don't promise that it will fix every line and wrinkle on your face, but certainly if you start young enough and have a regular routine of microneedling that you use at home on a regular basis, you'll actually help stop the clock yourself.